guys, good morning and welcome back again to my YouTube channel. How are you guys doing? I just woke up this morning and I just had a feeling of losing my hair. As I was listening to it, I decided to come speak with you people, more especially for pregnant women and for you expecting pregnancy. Yes, it will happen. So I want to talk about the glucose test that pregnant women go through or undergo during their 5 months of pregnancy. Okay, I don't know for other countries, but here in Italy, once it's 5 months, you would go for your pregnant your what is it called? Once it's 6 months, sorry, you go for your glucose test. Okay, you go for glucose test to know if you are diabetic in pregnancy or not. Please, I'm losing my hair. Ignore how I'm keeping my hair, okay? So the reason why I want to make this video is that I've come to realize that most people are misdiagnosed during this period of going for glucose tests. Yes, and before I say something, I must have encountered one or two persons that it happened to, and it equally happened to me. Okay, hence I decided to make this video. If you don't know, a diabetic test is that test that you do in pregnancy to determine if you are diabetic in pregnancy, if pregnancy give you diabetes. And this diabetes will normally go away immediately you are done with pregnancy. Immediately you expel the product of conception, the diabetes will fade away, everything will go back to normal. So it's not a normal diabetes that people suffer from. Okay, in this case, you just have to be diabetic during the period of pregnancy, and once the baby is born, everything goes back to normal. Okay, and normally how it's being done is that you go to the hospital. Before they carry out the first procedure, they check your glucose level. If it's okay, they will not give you a bottle of glucophage and you drink, a bottle of glucose and you drink. Okay, so I will attach a picture of the one I drank during my pregnancy. Okay, the one they give here. So why I say some people are misdiagnosed is this: some people don't understand the rule of going for this glucose test. Your gynae might tell you you will go for glucose test, that's all. You will not really know the procedure, what is required of you to do and not to do. So that is why I said to make this video. If you are pregnant and you are going for a diabetic test, there is a routine. Okay, during my own time, first pregnancy, I forgot. Let me not say I was ignorant, but the truth is that I forgot. Even if I use the word ignorance, it's still okay, because I'm in the field, so I'm not supposed to forget. But the excitement of you are pregnant and you forget some things and all that, you forget your profession. Okay, so before you go for a glucose test, it's expected that at least from 8 to 12 hours, nothing should go into your mouth, into your system. Okay, you can eat normal during the day, but once it's at night, you at least 7:30 you must have eaten. Now somebody will say, whenever I'm pregnant, I used to have this high appetite. I'm always hungry. I crave for a lot of things. Some people even eat by 10, according to some people. It's okay, everybody has his or her own way during pregnancy. But the thing is, it is supposed to be once it is 7:30 you must have eaten. Anything that is carbohydrate should not go into your system, from 8 to 8:30. 7:30, if you want to eat rice, you want to eat spag, 7:30, make sure you've eaten it. So you have 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6, 7, that is 12 hours. You can go for your test and you get the actual results. But when you eat if you eat a carbohydrate given food, it's possible it will affect the results because you did not maintain the rule of 8 to 12 hours. Why it is being said 8 to 12 hours, why I said 7:30 you must have eaten, because some people, you might go early and by 8 you will do the test. by 9 you will do the test. But believe me, this test is mostly done in the morning. Even in the hospital, if you go there, you hear an announcement, is anybody here for a diabetes check? The diabetes check, they'll run your test on you, because you have to stay. After they must have taken your normal glucose level and it's okay, they will give you that the drink. You drink it, and after 1 hour, without you drinking or moving around, just, I think you drink it. When they want to do the test, they will tell you, once they take your normal glucose level, they tell you don't drink, don't eat anything. You drink it, and they will give you 1 hour without movement. They will measure your body glucose level, and in the next 1 hour, making it 2 hours, they also take another one to determine how your system is functioning. Okay, so during my time when I was pregnant with my first baby, I wasn't careful of what I didn't even know what I ate. I can't remember what I ate that day because I wasn't careful. So I went for the test and it came out very high. Yes, it came out very, very high. And they told me, okay, your result is high. You have diabetes in pregnancy. I told them no, that I don't have diabetes in pregnancy. So I went to the hospital and I did a test. I ran a test, glucose test, and it was 84 that morning. So they were confused. Like, why is it that this morning is normal, but the day of the test, it was high? I told them I don't know, that maybe it might be a clinical error, but it wasn't an error. It was later I found out. So they gave me glucometer, told me I have to be monitoring myself, okay? Each time I eat, the first 1 hour, I will pierce myself to just check if the glucose level is high, and we are coming out normal. Then after some time, the thing was okay, but my result was showing on the day I did that test, I have diabetes. They even referred me to a dietitian, which they gave me things to be eating, which I didn't maintain. Don't be like me. If they give you maintain, I didn't maintain it. I was eating normal because I knew I wasn't diabetic. And for one day, I wasn't giving insulin. Okay, if you're diabetic in pregnancy, definitely you have to take insulin. So not all, anyways, depending on the level. So I kept monitoring my glucose level after eating every 1 hour and every 2 hours of eating, and it was okay. So there was confusion. Why was it high that day? I made myself at a point. I was thinking it's just what is it called, clinical error, until somebody said something. The person said maybe it depends on what you ate before you came to work. And in my mind I said, yes, this must be true, because if you ask me what I ate that day, I can't remember. Okay, because I wasn't conscious. I can't remember. It's possible I ate semo, it's possible I ate spark, depending, I don't know. So like normal, I don't really have cravings when I'm pregnant. Okay, I don't really eat when I'm pregnant. I just eat morning, afternoon, night, like a normal human being. Okay, so, and most times we go out and we'll come back late, so we'll just eat late. So I didn't know, I can't remember what I ate that day. I just went in for the test and it came out high. So after everything, throughout the pregnancy, I kept monitoring until I gave birth. Immediately I gave birth, they said everything was normal. So I was discussing with somebody, one of my colleagues, and she told me that she was misdiagnosed as well. That when they told her she had diabetes, she said no, that she doesn't have diabetes. And at the end of the day, she said it depends on what she ate a night before that day. And finally it happened that was true. She went in for the second time to go for this glucose test, and it came out normal. Okay, so she was conscious of what she ate that a night before that day. So during my second pregnancy, this current pregnancy I'm carrying now, I went for glucose test. When it was time, I was now very careful. That day I can remember very well that what I ate a night to that day, I ate by 8:30. We came back by after 8. If not, I would have eaten by 7 or 7:30. But we came back, it was already 8. After 8, I boiled egg, just one egg, and I ate. That was what I had for dinner. and in the morning I went for the test, and when the result came out, it was normal. Okay, it was normal. So what am I trying to say? If you are pregnant and you are going for this test, be careful of what you eat at night. Okay, be careful of what you eat before going for the test, because what you eat might interrupt the test, the actual results, if you are really diabetic in pregnancy or not. Okay, so that's why I say you have to be very careful what you eat, so you will not be misdiagnosed of having diabetes when it's because of the food you eat. Some people will say that when they go there, they were given just something small. Like in my own case, some people said they will be given just a shot of glucose for them to drink. But in my own case, in my hospital case in Italy here, they will give you how many meals of it. Let me see if I can find the picture. Let me know how many meals they give. It's even much for me. Oh, it's much. Okay, look at it. You finish this bottle, you finish it, this bottle, within 5 minutes. Okay, how many meals? This is 75 grams. It is 75 grams of, I want to check for meal. I don't know how many meals it is, but it's 75 grams. 180, it should be 180 meal or what? I don't know, I don't want to mistake anything, but look at what you finish in 5 minutes. Okay, so if you are going for this test to get in, if for you to get an actual result, please mind what you eat a night to that day. You can eat your normal rice, normal what is it called? You can eat your normal carbohydrate during the day, but at night, please be careful of what you eat before going to the hospital, so you will not be misdiagnosed. Okay, so that's what I decided to come and share with you people. Once, even if you are hungry after 7, you can eat protein, you can eat fish, you can eat meat, you can eat anything that is not a carbohydrate giving food. Okay, so it will not alter the results. Okay, thank you for watching. Let me just calm down and loosen this hair. Thank you for watching. I'll see you guys in my next video. For now, bye.